Hi, my name is Dr. Daryl Dykes, and I would like to go over the postoperative course for total knee arthroplasty and the postoperative course from this operation. In the immediate postoperative, patient will need to be aggressive, trying to regain motion and strength within the knee. We'll have the patient up and walking on the knee shortly after the procedure, or at the latest the next day if they are admitted to the hospital. As soon as the patient is able to ambulate, get themselves safely in and out of a bed, on and off the toilet by themselves, they can go home at that point. For most people, this can be done immediately postoperatively in the postoperative area. If you're admitted overnight, we'll have the therapy see you in the hospital room and get you up moving the next day. Once again, we're just looking for you to be independent and safe to go home. If you are unable to do so, we may need to make recommendations for a rehab stay at a local facility for rehabilitation after you leave the hospital. The vast majority of people are able to go straight home and have therapy set up in the household. After the procedure, you'll have a waterproof dressing on the front of the knee. This will allow you to shower once the drain has been removed. For most people, the drain is removed on the first day after the procedure. And once the drain hole has sealed up and there's no further drainage from that site, which is a few hours after it's been pulled, then you can safely shower and let water run over the outside of the wound. This is nice in that it helps with hygiene, but it also makes it very easy for you in the household setting, as you do not have to do dressing changes on a daily basis. It'll be very important for you to work your way through some of the pain after the procedure. What will get you in trouble is just shutting down, I can't bend the knee, and that creates a great deal of problem. A stiff knee is not a happy knee. We really want to emphasize full extension of the knee immediately after the procedure and flexion of the knee as much as you can tolerate. We do medications orally to help with that pain after the procedure. You'll also go home with an ice machine after the procedure, which really helps with the inflammation and pain after the procedure. For most people, you come back in 2 weeks after the procedure to have your staples removed, and for x-rays, you certainly can feel free to come back at any time after the procedure if you feel like there are any issues with the procedure. If there are any unexplained fevers, increased redness in the leg, fevers, chills, anything that seems out of the ordinary, please let us know and contact us in the Pelham office. Another thing that is very common, most people having major orthopedic surgery will have some swelling distal or down the leg from the procedure. If you're having some mild to moderate swelling in the leg, use an ACE wrap, elevate the extremity. It is especially useful to make sure when you're elevating the leg that the foot is higher than the knee, is higher than the hip, which allows the swelling to flow out of the leg. Think of it as water flowing out of the extremity. Another thing to look out for is blood clots. They are occasional complication after this procedure. Things to look for is a large, hard calf, difficulties flexing and extending at the ankle, and that producing increased pain. Any of those symptoms should warrant a call to our office, and the next step would be to get an ultrasound done on the extremity to rule in or out blood clots. This has become rare after the procedure as we use anticoagulants to decrease that risk in the postoperative period with a total knee. This is usually about a 2-week period that you're on the anticoagulants, and most people are moving well at that point and no longer need the anticoagulants. Please feel free to contact our office if there are any questions postoperatively, and we look forward to seeing you at the 2-week visit.